Hey, everybody, it's Dr. Timothy Brown. I am a member of the National Optometric Foundation, and we are with you to share some insightful information. We have a guest speaker that's going to be on with us on this webinar, Protecting the Vision. And we're going to talk about dry eyes, and we're going to talk about health clinics and give you some details about those clinics and let you answer questions that we may ask or that our guest speaker may ask. And also, you can ask questions for our guest speaker tonight. Before we bring on our guest speaker, who is a dynamic guest speaker for tonight, so go ahead and grab your popcorn and get your favorite drink, because this is going to be an insightful webinar as we close out 2024. All right. And the National Optometric Foundation, who are we? We are a nonprofit foundation. We are the financial support for the National Optometric Association, and we try to physically support our association in various ways. We team with them as well as other partners and doctors and optical groups and technicians, and we do free eye exams each year at our conventions that we have all around the US of A, providing free eye exams, teaming with people like VSP who provide frames, lenses for patients. So patients usually can leave with a free eye exam and a free pair of glasses, helping them to see better, preserving the vision. And we also will dilate some of the people so that we can check the health of the back of their eyes as well. So if you may be listening to this and you haven't had an eye exam, don't delay, get it today. Call your local optometrist and make sure you schedule an eye exam. The foundation also try to support students who are in optometry school that are a part of our National Optometric Student Association in various ways with scholarships, trying to help them get to our conventions that we have each year. We also try to support students who are in high school, maybe not sure about a career choice, or they're thinking about going into optometry. We try to give them some insights, and we also invite them sometimes to join us on convention. And we'll be in Ohio in 2025, and we hope that docs, if you're watching this, that you're already registered, go ahead and get that early bird special so that you can join us, the NOA family in Ohio. It's going to be a great time. I know it for sure. Go to our website. We have information already on the website about this. So if you want to follow us, I want to give you some ways that you can follow us. We're on Facebook as the National Optometric Foundation. We would love for you to be a part of us and follow us there. You can also go to our website. We have www.nationaloptometricfoundation.com, and we're also on YouTube. Some of you may be watching this live on YouTube right now. We're on YouTube as the National Optometric Foundation, and because we are a foundation, a nonprofit organization, you can contribute to our foundation. It could be a tax write-off as well. We have a cash app where you can send that donation, and our treasurer will surely accept your donation. We appreciate it in advance. It is $ protecting the vision. This will allow us to continue to do the great things that we do in supporting the National Optometric Association, the students in optometry school, thinking about going to optometry school, and the various ways that we try to educate the community and be involved in the community when it comes to protecting their vision, especially underserved minority communities, protecting you and educating you about the 3 silent killers of your vision: glaucoma, diabetic retinopathy, and hypertensive retinopathy. So schedule your eye exam with your local optometrist, call them up, get on their schedule. If you haven't had it in 2024, do it for 2025. Please, folks, don't delay, do it today. I'm excited to have a guest speaker on the show with us tonight. This is Dr. Joyce Ramsue Thompson, and I want to just tell you, Thompson, and I want to just tell you a little bit about her. She graduated from Illinois College of Optometry and has practiced optometry for 43 years. You heard me right, 4 and a 3, 43 years. She's practiced in multidisciplinary settings. Most of her career starting with Kaiser Permanente in Cleveland, Ohio, and lastly at the federally qualified health centers in Cleveland and Lorain, Ohio. She currently practices at Lorain County Health and Dentistry as a staff optometrist and has been in her role for 10 years there. She's also provided eye care at Northeast Ohio Pre-Release Center, a women's correctional institution in downtown Cleveland, And she always enjoyed working where she have the advantage of seeing patients the entire medical record there, and she feel like she have a large piece of their health in her hands, and it helps her tremendously seeing where it fits into the puzzle there. That's the great things about optometrists. They work hand in hand with your other doctors, your primary care doctor, your medical doctor. We're one big team, and your optometrist can be the gatekeeper. We are the gatekeeper to the healthcare system. Sometimes we will see things and notify your primary care doctor to do additional testing from concerns that we may have from having your eye exam done by us, dilation as well. Dr. Thompson is a life member of the AOA and the NOA. She is a past NOA board member, serving as Regional 2 trustee for 10 years, and a former NOF board member. She is a life member of VOSH and participated in mission trips to Haiti and Ecuador. She served in various capacities with Prevent Blindness Ohio, as well as other community positions in Cleveland, Ohio area. This lady is a busy, active community leader. Stay tuned. She's going to come to you live in just a moment. Her practices have been largely medical in underserved and underinsured populations. Thank you so much. Treating glaucoma and numerous red eye conditions, many in advanced states due to various obstacles preventing access to care. She can say without a doubt that dry eye has been close to the top of the list of chief complaints that she's encountered during her many years of practicing, second only to blurry vision. And this evening, if you stay tuned, go ahead and notify your family and friends. She's going to try to give you a few practice pearls from her experiences with dry eye disease and give us some insight into the federally qualified health centers that she's had the opportunity to work at and help a lot of people in the community. So without further ado, let's give Dr. Joyce Ramsue Thompson a warm welcome to our webinar, the last webinar, Dr. Thompson, that you have for 2024. I know you're going to close us out in a big way, in a very special way, and I'm so excited to have you on this webinar tonight. Thank you so much.
Thank you, Dr. Brown. You've given me big shoes to fill.
Yes.
Okay. So this topic is very near and dear to me, mainly because I have dry eye. I have family members who have dry eye. I'm constantly giving my mom and my sister artificial tears and the eye mask. So let's just talk about what is dry eye. So a normal healthy eye has sufficient tears to provide comfort and lubrication, which provides comfort, as well as it provides moisture. So that provides clear vision. So if you could put up the schematic, I want to show you the schematic of the tear film. So as you see, the top layer of the tears is an oily layer. And that oily layer we call mebum. And it prevents the watery layer, which is the second layer, from evaporating. And then the third layer is the mucus. And that mucus layer causes even spreading of the tears. And it also contains antibodies and proteins to resist infection. So these components are all secreted by special glands in the eyelids. If there is an imbalance or deficiency in any of these layers, then we experience dry eye. So over the last 10 years, there's been an increase in the number of dry eye patients. Would anyone care to take a guess on why that is? You can write it in the chat, and Dr. Brown will let me know what you're writing. Is anyone answering the question there, Dr. Brown?
Not at the moment there. If they do, I'll definitely come back to that and see. But from what I'm understanding, with you having dry eye, you have all the goodies. So when most people are bringing cakes and desserts and pies and food to the family reunion, you're bringing eye drops for dry eye.
That's true. I do. I do. That I do. Well, I'm going to go ahead and answer that question because over the past 10 years, there's been an increase in people staring at electronic devices. So when they stare at these electronic devices, they don't blink. the tears evaporate, and then that causes dry eye. So that's the main reason why it's increased, because everybody's staring at these cell phones all day long.
Yes, yes. When and speaking of staring at cell phones, I noticed that a lot when patients come in to see us, the children are all into their tablet or their cell phone. Now, if a group of children, and we've had this, come in and they already have books in their hands, we reward them for having books versus electronics in their hand when they come in the office there. But it's happening a lot, as you said. The world is changing. We have access to so much from the palm of our hand, the cell phone, even the watch. There's so much now that you can do right from your watch. So that's just they're getting smaller. We're getting everything locked into your phone, checking into your flight, checking into your hotel now using your phone. So it's a lot being done with your devices there, and reason why we're having that increase of dry eye cases there. But,
yeah, and I usually, the parents usually give the kids the phone as a babysitter.
You're
to
right.
keep them quiet while they're in the exam room. And I'll usually say, that phone is too close to your face. And mom will say, okay, move it further away. I told you to do that. The child's still sitting there with the phone right here. So
yes, I witnessed this today. Siblings came in, one for the eye exam, the other one not. So the other one who didn't have an eye exam, that was, as you say, the attention grabber the entire time that they were here. I tried to hold a conversation, but I guess I just didn't have that magic to pull them away from that device there. So, but I try to get them away. We have coloring books. We have a kids station with books and everything on the table to encourage them, and we'll actually, take them over there and take a look at it. But if there's something that they want to watch on that device, it has a lot of power over books now and other things.
It really does.
Yes, yes. Well, it's good that you told us what dry eye is and all the different layers that's right there. A lot of people don't sometimes understand that when they go to optometrists and they're trying to explain, hey, I'm looking at this and this is what we found there. So I hope that picture kind of gave you guys some insights into how dry eye can occur and the different layers that's involved in preventing you from having the symptoms of dry eye there on that tear film there. So she was saying anytime any of those layers become deficient, it can lead to dry eye. The eye starts drying out and you start having a big problem. So I will ask you, Doc, what is the chief complaint? What is the patient's chief complaint? What do they come in saying to kind of hint to you that they may be having some issues with dry eye?
Well, they will say my eyes burn, they sting, they itch. And with me, when I first wake up in the morning, sometimes it's hard for me to open my eyes. It's like there's no moisture to make my eyelids move. They may have stringy mucus. The eyes are very sensitive. Their vision is blurry, and then their eyes tear. So they're very confused when they say, well, why are my eyes dry if they're tearing? So I'll explain, well, you have a basal tear layer, and then that basal tear layer is deficient. So you have reflex tears that are produced because your eyes are irritated. Those reflex tears are mainly watery component, so they don't last that long. So once you explain that to them, they understand that, okay, those are reflex tears, my eyes are dry.
Yeah, wow, great explanation right there, because we have that challenge often. They were like, no, I can't have dry eye because my eyes are watering all the time. I'm getting a lot of water and everything, and you have to break it down. That's your deficiency, and those basal tear and the basal tear layer there that's causing those reflex tears to kick in. There's triggering that reaction there, which let us know that you can use some help when it comes to moisture. And it's, I know it's not what you would say is a good thing, but you have the experience and for dry eye, so you can speak from experience and you can let them know, like you can be transparent and say, hey, I'm dealing with the same thing. This is what I have done to find relief, and then hope that patients follow that, guideline that you give them, to get the relief that they need when it comes to dry eye.
Correct.
Yeah. Do you find that patients sometimes, when they start feeling good, they become less compliant?
Oh, yes. I'll ask them when they come back. I said, "Well, are you still using your tears?" "No, I don't need them." So they just stop. May say, "Well, I don't have any more. My prescription ran out," but yet and still they never call back to get it filled again. So
Right.
if the eyes are better, they stop the drops.
Right. So I bring that up because someone listening, you guys, I'm speaking to you. If you're listening, it's important that you help the doctor help you. Follow the guidelines. And if you know you haven't been following the guidelines, just be honest. We are trying to partner with you to give you the best eye care possible. And that works extremely well when we have patients who are partnering with us and following, the simple steps that we give you to find relief, either dry eye or whatever other condition you may be seeing your optometrist about. That's very important there. So just wanted to bring that up so you guys can know this is teamwork. We partner with your primary care doctor. That's why sometimes we'll get referrals from your primary care. We'll get referrals from the PCP because they are trying to get you in for a full comprehensive eye exam because they noticed that you didn't do so well when they had the eye chart up and you're reading the eye chart. So Dr. Joyce Ramsue Thompson is going to continue to talk to us about dry eye, and I'm interested in you going into a little bit more detail, if you have that, about what causes dry eye and everything. And if you have any more questions that you'd like to put out there to our listening audience there, you can do so as well.
Okay. So as I said, dry eye is an imbalance in the tear film. So it's not just the lack of production of the watery aqueous layer or a lack of production of the oily layer. There may be inflammation. So sometimes I'll look at the eyelids and I'll see these little crusting and flakes. So there's inflammation there that causes a tear film instability. There may be, you lose a lot of your tears from evaporation. So there are things in the environment that can cause that as well, or in your own home. So if you have a fan, many people like to use fans. So I can't have a fan blowing even in the ceiling because it does dry my eyes out. Air conditioning can cause them to feel dry. If you have if your room is very hot, low humidity, they will be very dry. Allergies can cause dry eyes. If you've worn contact lenses for a very long time, that can cause dryness as well. Refractive surgeries, if you have LASIK surgeries, that can cause some dryness. I have patients who have permanent eyeliner tattoos, and that destroys the glands in the eyelid, so that causes dryness as well. So infections in the eye, your eyelids sticking together, there's mucus draining, that can cause dryness as well as inflammations. So again, you see flakes and crusting on the lashes. There's also infestation of mites that can, and I did say mites.
Wow, I was going to stop you there and say, hey, are you saying the right thing? Wow, listen up, folks.
Yes, and these little mites, they call them Demodex. They sort of live in your lashes. So those sometimes it's very hard to get rid of that, but that also is a cause of dry eye. Also, there's systemic and ocular medications that can cause dryness, like antihistamines. If you're on anti-anxiety medications, that can also cause dryness. And we also have what we call partial blinkers. You blink and your eyes, their upper eyelid does not completely come in contact with your lower eyelid, and that can cause dryness. You may sleep and your eyelids are not completely closed. You lose, your tears evaporate from exposure. There's also something called inadequate lid seal. So if you're sleeping and your upper lid does not come in contact with your lower eyelid, again, you have exposure. That can cause damage to your cornea, and your eyes will hurt and burn. So if you wake up in the morning and your eyes feel really, really bad, more than likely you have the inadequate lid seal. So if you wake up and your eyes are fine in the morning, then you probably don't. You probably have some other type of issue causing the evaporative dry eye. So dry eye is also linked to certain autoimmune diseases like Sjogren's syndrome. That's where you have dry eye, dry mouth, and arthritis. Rheumatoid arthritis can also cause dryness, changes in hormonal levels, and that affects us women. Your risks are increased for dry eye if you're going through menopause, hormone replacement therapies. All those things can increase your risk for dryness. Also, your risk increases as you get older as well.
Wow. This is a long list of things that people listening probably didn't realize could contribute to dry eye. And you can make some adjustments, talk with your eye doctor about your environment that you're working in or that you're living in, and they could be increasing the symptoms that people have with dry eye because of that. You saying that you can't have a ceiling fan in your house, on, wow. I have a ceiling fan on often. As a matter of fact, we had some family and friends over this weekend at the house, and we were doing some games and we did karaoke. So, it was getting a little warm with all those bodies in there. So I flipped the switch and the fan came on. And man, I got some feedback from people like, "Oh, I'm too cold, but it's a habit, I'll get hot, I get warm, I turn that fan on, but some of our guests, they immediately let me know, oh no, this is not going to work. It felt like I turned on the air conditioner to them.
Oh, so, I'm like that. So
my mother-in-law will also let me know if I turn on the ceiling fan. She's like, oh no, I can't take it. So I had to adapt and turn that fan off and just deal with it myself. So it was okay. But that is a long list, medications, age, hormonal changes, the environment that you're in, and inflammatory conditions, ocular disease, can contribute to dry eye. And people come in and they don't realize. That's why we always try to encourage you all to get an eye exam every year with your optometrist. Call them up, get on their schedule. Don't put it off. There are things that you need to make a priority in your life, and taking care of yourself, taking care of your mental health and your vision. Those are things that I want to stress tonight. That's important for you to make a priority. Sometimes as parents, we'll get our children taken care of, but we never get on the schedule to see an optometrist. So to that parent that may be listening to me tonight, I want to say it's your time. Time for you to call your local optometrist and get on their schedule and make sure, if you can't get in, because this is a very busy month in December to get with an optometrist, but at least get scheduled for 2025. There are a lot of things that optometrists have found that have saved vision, saved lives, okay? So we're not just giving you glasses and contacts. We're actually saving you from dry eye symptoms, saving you from dying as well there. So to all the optometrists out there, we thank you for your contribution to the community. And also, Doc, thank you for giving us that list of things that can cause dry eye there. Questions? Do you have any questions for the audience? I haven't had an answer on this side yet, but if you have some questions or if you want to share.
Well, I want to. Yeah, Doc, I have a dry IQ question.
Oh, okay. Okay. Let me get that on the screen there for you. Let's see if we can get that up there. Here we go.
So this is the questionnaire, but this is something that I want the listening audience just to think about. So it's a true and false question. And dry IQ, it is not necessary to see your eye doctor because dry eye is not a serious condition. So if you're listening, and if you're not an optometrist, I'd like for you to put your true or false in the chat. We'll come back to the answer at the end, but we're going to go through right now this questionnaire. So there are some specialized optometrists who specialize in taking care of dry eye issues. So this is a questionnaire that many may use in their private offices. So this will determine if you have chronic dry eye disease, or if it may be, or if you may not have dry eye, or your dry eye may be very mild. So you can follow along with us here. So on number A, it says, have you experienced any of the following? So physical symptoms, eyes that are sensitive to light. Here you would say all the time, before, half the time, or none of the time. So you would do that with all the other questions: eyes that feel gritty, painful or sore eyes, blurred vision, poor vision. So say if, okay, you had scores of 2, your total for A would be 10. So we go down to B. Have problems with your eyes limited you in performing any of the following daily activities? Reading. Does it bother you all the time, half the time, or none of the time? Driving at night, working with a computer, watching TV. So if you answered 2 on all these, your answer would be 4.
And just to make sure, this is coming off of the flyer that we should have up on the screen there that you're going through?
Yes.
Okay. Let's see if we can get that on the screen there, so some of our people in the audience there can kind of see what you were going through, make it a little bit easier there.
I'm sorry. I thought it was up there.
No, I can't see it up there. Let me see if we can get it up there so that they can see it as well. So let's put the questionnaire up on the screen there. Let's see. I'll reach down to see if Nate can get that up for us there, and that way we can kind of have an idea of what you're going through there.
Okay.
I know it was up briefly before when you started there, and here we go there where it says take the dry eye questionnaire.
Correct. That's it.
Okay. Yep. Okay. We got it up now.
So this will help determine if you have chronic dry eye disease. And if you can print this out on your own. So I'm going to start over again. So A, have you experienced any of the following? Physical symptoms, eyes that are sensitive to light. If you have this symptom all the time, it would be 4. Half the time, 2. None of the above, 0. Eyes that feel gritty, same thing, all the time, half the time, none of the time. So you would score yourself painful or sore eyes, blurred vision, poor vision. So, okay, say this happens half the time. So you would score and you would write 10 as your total. Have problems with your eyes limited you in performing any of the following activities. Reading. Again, you score yourself half the time, none of the time, all the time. Driving at night. Working on a computer, watching TV. So if you scored, say, 2 on these, your score would be 8. Have your eyes felt uncomfortable in any of the following situations? Environmental factors. Windy conditions, places with low humidity, it's very dry. Does your eyes bother you? Areas that are air conditioned. So again, say if it's half the time, you would have a score of 6. So if you add all of these up, I think I had 10 at the top, and 4 is 14. That would be 20. I think I'm correct. So in D, you would put the letter 20. So what you do here is you answered all 12 questions. So you're going to use 12 on the vertical, and your total score was 20. So where 12 and 20 meet, that would be your score. You'd have 20.8. So your eyes are mild. You have mild dry eye.
Oh, wow.
So you can print this out and use this, take it to your doctor's office, show your optometrist and say, hey, I took this questionnaire and I have mild dry eye. What can I do? Wow. So I wanted to share that with you.
Wow, that's a great roadmap to follow for trying to, get an idea of what range of dry eye, you may be at, mild, moderate, or severe. And I know a lot of you who are in that severe category, you'll know for sure because you're going to come in with those symptoms that she was talking about, that burning sensation and stinging that you're having there, all because the basal tear layer is becoming deficient, and then you're triggering that reflex tears there to happening there, and your eyes start watering and tearing a lot there. Um, we want you to come in and see us. Don't delay that part there. So you use this questionnaire that helps get an idea of where the patient may be there. And the assessment that you do, the diagnosis, can you talk a little bit about that, how you go about doing the assessment and then coming up with a diagnosis for dry eye?
Yes. So after you finish the questionnaire, we know what your symptoms are. So now we need to determine what the signs are. So in my practice, I use a slit lamp, and I think all optometrists have that one piece of equipment. It's very valuable. So you're going to use this. The slit lamp is like a high. There you go. He has one right there in his office. So it's a high mag microscope and allows you to look at the front surface of the eye. So we look at the tear film. Okay, we look at the eye. We look for inflammation. Again, we look for that infestation of mites that we talked about and any eyelid abnormalities. So does the eyelids turn in or do they turn out? Is there incomplete lid seal that we talked about? We look at the tear prism, the height of the tear layer as it sits on the lower eyelid. So one test that's very valuable is we call the tear breakup time. So this assesses evaporative dry eye. So it measures how long a patient's tear film lasts after they blink. So you set them in the slit lamp, you instill a little bit of dye, a sodium fluorescein dye. You ask the patient to blink. You look at that tear film under a cobalt blue light, and you record the time it takes from the time that they blink until the time that you see a dry spot. And you could tell the dry spot because all the fluorescein sort of dissipates and you'd see a little circle there with no fluorescein. So a normal person would have their tear film would last maybe on average about 27 seconds. Abnormal is about 10 seconds, and dry eye would be less than 5 seconds. So, and I see a lot patients blink, and all of a sudden, all you see is little dry spots. So they're almost very at the point of being severe dry eye. That fluorescein also would stain any kind of damaged tissue on the eye as well. Another test that we do is called the Schirmer test. And you put a little strip of paper, sort of like a litmus paper, inside the eyelid, and it sticks out of the eye. And over a period of 5 minutes, you look and observe how much tears are absorbed onto that little strip of paper. So it can be done with anesthesia or without. And think about having a little piece of paper sticking out of your eye for 5 minutes. You're going to get reflex tears. So it may be better to do it with anesthesia, so you get a better so you get a better reading because you don't have the irritation there causing some reflex tearing. So these are the main things that I use in my office, but some of the practitioners that are considered dry eye experts, they use other instruments they call LipiView. This measures the thickness of your lipid oil layer. There's some called mebalography. It takes a picture of your meibomian glands. And again, these meibomian glands secretes meibum, which is that oily top layer. And normally you have about 30 to 40 glands in that upper lid and about 20 to 30 in the lower lid. And sometimes you may have to express those glands to get that meibum out. In the normal healthy eye, the meibum should look sort of like olive oil, whereas in a patient that has meibomian gland disease or dysfunction, the meibum would be more of a yellow thick mucus or white mucus. So another test, which I don't do this one as well, is called tear osmolarity. It tests the saltiness of a tear. Again, it's like you have like a little litmus paper, and based on the measurement, it will determine the severity of your dry eye. But I think of all of those, the slit lamp is probably the best, gives you the most information, and that's what most optometrists use in their practices.
Right, and that's what we did a lot in optometry school, use the slit lamp. And like you said, when you do that dry eye check, you see damage to the cornea as well, the front surface of the eye. Things will show up from there as well. So you outline that very well, all the different ways. And I know I have buddies who do specialize in dry eye, and they have more equipment and they do more testing for dry eye. Just like if someone would go to someone who specializes in glaucoma or come to us where we specialize in vision therapy, so they go a little more in depth with the testing and the equipment that they have there. But most optometrists can do the testing in the beginning that she outlined and see if you have dry eye. And then they can talk to you about treatment process there. So that leads us into the next line I wanted to ask you for the treatment process there. Are there things that you go to? And then also, do you find sometimes that dry eye can be misdiagnosed because of it having symptoms similar to something else? Because sometimes we have that. Is dry eye one of those things that could be misdiagnosed?
Yes, you're right. Many patients if the dryness has been there for quite a while and it just seems like nothing they do, a lot of times they'll just go out and buy Visine and they'll start putting that in. They go to the emergency room. And when they go to the emergency room, most emergency rooms do not have the slit lamp. So they're not able to really look at that tear film. So they will think, oh, you just have an eye infection, and they give them an antibiotic eye drop. So they take that eye drop for a couple of weeks, and then they end up in my office and they say, oh, I'm taking this. My eyes are still red. They're even worse. And the reason being, and I say, okay, first of all, we're going to stop taking the drop because there's preservatives in those tears. In the antibiotic that can exacerbate and make that dryness even worse. So I take them off of that, tell them to use warm compresses, maybe add some artificial tears to that, and that solves their issue. So how do we treat the dry eye? So there's things that you could do at home, warm compresses, lid massage. So I tell my patients, just take a washcloth, run under warm water, close your eyes, and then you're going to just massage. So you're actually helping the meibomian glands to secrete that oily layer to help reduce the evaporation of the tears. You look at the lid hygiene. Make sure that they're taking that mascara off every night. And one thing I ask my patients, I said, well, how old is your tube of mascara? Someone may have it 2 or 3 months. And I always say, okay, think about this. You have your little brush, you're putting the mascara on, then you're putting it back in the tube. That tube becomes the incubator for bacteria. So I always recommend that you toss your mascara every month or two, because otherwise it can cause an infection there. If you have an infection, it's recommended that you toss that mascara or any liquid eye makeup that you're wearing, because you're reinfecting yourself if you don't toss that. And the blinking is also important. So we've developed, the American Optometric Association came up with the 20-20-20 rule. So many patients are spending hours and hours literally looking, and I always say with the cell phone almost attached to their nose. So I tell my patients every 20 minutes, you need to look at something 20 feet away, and it gives your eyes a chance to rest. I also tell them, make sure you blink when you're looking up and looking away. And that actually would help with the dryness as well. There's also in-office treatments that I had mentioned before with the meibomian gland expression. They use something similar to a forceps, and they would squeeze the eyelid, and it would express the meibomian out of the glands. I've even been able to just take the eyelid and push it against the eyeball, and you can see the mucus coming out. So, but those are things that I would do, and I would discuss that with the patient. There's punctal plugs, which I have them myself. You plug the lacrimal ducts. so that the tears doesn't drain out. And that increases your tear volume, which actually provides long-term, it gives you instant long-term relief. So you don't need to use the artificial tears as much. There's specialized contact lenses for the more severe cases. There's something also called intense pulse light, IPL. So this is light frequency that's applied to the skin of the eyelids. It's very effective in meibomian gland disease. And this also would be a piece of equipment that's found in the office of someone who is specializing in dry eye. Demodex treatment. So again, you have the mites on the eyelids. So there's solutions that you can use and you put it on the eyelid. Some people mix up this tea tree oil solution and they put that on the eyelids. And that actually, you need to have it applied several times, but that would actually kill the mites on the eyelids. So then there's medical treatment as well. Artificial tears, again, is one. But sometimes that artificial tears doesn't actually give you immediate relief. So if there's inflammation on the eye, sometimes you may need a short course of a steroid eye drop. That would give you some relief. If there's inflammation, there's also the cyclosporin eye drops, Xiidra, Restasis, Cequa. And you've probably seen commercials on television for those medications. And they block inflammation and they increase tear production. So if there's infections in the eye, you may need to be on an antibiotic eye drop or ointment. If you have the really bad meibomian gland dysfunction, sometimes you need to be on oral medication, long-term low dose antibiotic to reduce that inflammation. Infections, again, the antibiotic eye drop or ointment. If there's allergies, antihistamine eye drops. And it's recommended that your medication be preservative free because a lot of these preservatives can make the dryness worse as well.
Right. Right. So they might notice those little individual tubes that you can twist the top off of, and you might be able to get 2 uses out of it for the preservative-free dry eye drops there as well. Doc, what about I got a 24-pack of Aquafina water. Will that help me drinking more water? Would that help with my dry eyes?
Stay hydrated. Yes.
Hydrated. Okay.
Yes, and because especially if you're on medications, and I always say, I ask them how much water do you drink? Oh, I drink a lot. I said, well, how much is a lot? Oh, maybe 2 bottles. And I said,
right.
Not a lot. I said, it's recommended to drink about 8 glasses a day, which would equate to about 4 16-ounce bottles. And I said, if you're taking medication, especially these anti-anxiety medications, and the antihistamines, they really dry your eyes out. So I said, you need to even drink more water.
Right. And notice, folks, that if you're having symptoms of dry eye, if you're being diagnosed with dry eye, don't forget when you go on your trips, because when you go in different climates, the heat, the humidity may be higher. And like she was telling you earlier, depending on where you are, that can cause your symptoms of dry eye to increase there. And sometimes when we're on these trips, we don't think about our water intake. We're not counting how many glasses of water we're drinking. So just remember those things, because I know a lot of people are traveling. It is the holiday season. You're going with family and friends, or maybe they're coming over and you got a lot to do. But don't forget to stay hydrated while you're going through this holiday season and you're traveling and everything too. Just want to put that. Okay, so that's good. And so dry eye, we know what it is now. We know what you do when patients come into the office to do your assessment and your planning and your diagnosis there. The questionnaire that you gave us, you told us about the process of treatment and everything there. Is there anything that can make it worse, or anything that patients can do that you recommend when it comes to, relief? You kind of touched upon their relief from some of the symptoms of dry eye, and then maybe just talking about the prevalence of dry eye disease there as well, as we are shifting from dry eye to talk a little bit about the health clinics that you've had opportunity to work in as well.
Okay. Yes. As I mentioned before, fans can make it worse. Smoke. And I hate sitting in the car with the air blowing in my face. I can't do that.
Yeah.
And hair dryers, all those things can make the dry eye worse. So what can you do as a patient to relieve the symptoms? So artificial tears, I mentioned, the warm compresses, turning the fans off. And some people have to sleep with the fan blowing. So I say, okay, if you have to have the fan blowing, I would suggest that you sleep with an eye mask. You can add a humidifier to your room. And again, we talked about staying hydrated. Now, there's some blink exercises I want to have you practice, because the blinking is very important. You should be blinking 10 to 20 times per minute. So some people partial blink, but you have to make sure that that upper lid touches that lower lid. So that helps to spread the tears over the eye, and it also helps the meibomian glands to produce that mebo. So we're going to do a little exercise. So I'm going to have you, what I want you to do is to gently close your eyes, and I'm going to count to 1, 2. Then we're going to squeeze the lids together, count 1, 2, open 1, 2. So, okay, everyone, close your eyes. 1, 2, open. No, I'm sorry. Close, 1, 2, squeeze, 1, 2, open, 1, 2. Again, close, 1, 2, squeeze, 1, 2, open, 1, 2. So this needs to be repeated 5 times over a period of an hour for 2 weeks. So this would help to train you to blink properly. Then after the 2 weeks, you could do it 4 times a day. But if you're going to be on a computer, you need to maintain that 5 times per hour while you're on the computer. Also, you can get these. There's an app you can also download on your phone. It's called Donald Korb Blink Training. So this would actually allow you, it helps you, and it can set up a time to remind you when to blink. So you can find that on, I think it's on, I know it's on the iPhone. I think it should be on Androids as well. It's called Donald Korb Blink Training. I have a few little things here, my little tears, and this one you can spray on your eyelids. I haven't tried that one before, but you spray it on your eyelids and it goes in your eyes. This is an eye mask. You stick it in the microwave. Also, I have an electric eye mask, which I love. I gave my mom one. So this one you can, when I get in bed at night, I plug it in. It has a little control on it. You set your time, you set your temperature. So usually I do it for about 10 to 15 minutes, and it actually is very relaxing, and it can help you go to sleep. So the thing that we've noticed that dry eye is more prevalent in women, and that's probably due to the hormonal level. If you're pregnant, you're on birth control pills, hormone replacements, menopause, you're at higher risk. Again, we talked about Sjogren's syndrome and the arthritis. So the take-home message is, if any of these symptoms apply to you, you need to call and make an appointment with your optometrist, because dry eye can cause permanent damage, which could lead to vision loss. So did anyone put anything in there in the comments about the IQ question, dry IQ?
Dr. Whitehead was saying that he was about to answer some questions there, but I haven't seen his answer. But we do have Jackie. Jackie Davis said, do I tend to blink more or blink less when I'm working on a computer? Is her question to you there.
Well, I blink less. And I think most people blink less. What about you, Dr. Brown?
I think I blink less because, you know what? I start focusing on what's on the screen so much, and you forget about blinking,
Right.
That's why I was just talking with someone, I think today or last week, about what do you do, day in and day out. And they were talking about how they're in front of the computer 8 hours a day. So then, you want to suggest to them, like what you're saying, 20-20-20 rule, for every 20 minutes, take 20-second break, look 20 feet away, and do that complete blinking, to replenish and let those tears spread over the entire cornea as well there too. But blinking less because we're locked in to what's on that screen there as well.
Correct. So,
Yeah.
and actually, we're going to go lead into the community health center. I've been working at a community health center for about 25 years. I worked in Cleveland at Huff Norwood for about 13, 14 years. And I've been at this clinic. Actually, it's 11 years now. Anniversary was back in October. So I'm going to give you the definition of what the National Association of Community Health Centers had on their website as they describe what a community health center is. They're nonprofit, patient-governed organizations that provide high-quality, comprehensive primary health care to America's medically underserved communities, serving all patients regardless of income or insurance status. And when it says patient-governed, that means that 51% of the patients, 51% of the board has to be patients in the clinic.
Wow.
Yes. So I know our board, I've done some board presentations. So our board is composed, they are in compliance because our board president is actually a patient.
Oh, wow. That's
So
good.
they also provide preventive care, which I think is awesome, which includes health, vision, podiatry, oral, mental health, substance abuse, and they're located in about 15,000 sites, strategically located in inner city areas where providers don't want to work because they don't want to accept Medicare or Medicaid. And that could be because the reimbursement is low. So they're strategically located in the inner city. Like I work in Lorraine, and that's inner city. So they could be located. And we have one site that's in a public housing. Some of the sites are located where there are migrant workers or where there's homeless. So the biggest issue with that population, the uninsured, underinsured population, is there's barriers to care. It could be transportation. It could be there's no access because there's no one around to go to. So the goal is to reduce those barriers to care. That's why they are located in the areas that they are. And we do get federal funding, which covers construction, it covers salaries. And I have to look at my CEO because she's on it. I think we have 5 clinics, and we have optometry we had optometry in 2 of them. But in 2019, the community health centers provided access. They saw 32.5 million patients per year. So they have a tendency, they save lives, they save taxpayer dollars. Of the 15,000 community health centers, there are only maybe 25% that have optometry. And that's not good compared to dentistry, which is 82%. So there's work that needs to be done. The community health centers are backbones of the American primary care system. They are an efficient model of care for about 10% of the U.S. population. And they, in 2019, we had 41,000 optometrists practicing in the United States, and only 398 were practicing in community health centers. Now, the CDC has declared that vision loss is a public health crisis, but very little is being done to increase the delivery of care very little is being done to increase the delivery of eye care services in these community health centers. Rural health centers, that's another health barrier because there are no providers. There's an increased barrier because of transportation, increased barrier to care because no one can drive 1 or 2 hours to see a specialist or to get their eyes examined. So I think the other thing that I wanted to mention was in the community health centers, if you don't have insurance, you can be seen, you are rated based on your income, and you may pay a nominal fee for your service for the exam. I think for vision care and medical, it's $20 for the exam. We also have a program with one site, which is sponsored by Essilor. So a patient with no insurance, and which is usually our Medicare patients, they come in, they can get the exam for $20, and they can get a pair of glasses at no charge to them. So there are resources that we try to provide for our patients to make the access to care and barriers to care easier, so that the patients will come and get their glasses.
And that's great. And a little disappointed with that 25%, being dedicated to optometry or having, service optometry units in those clinics. But it's good that those clinics are there because they're catching a lot of people who would not have access to that care. They're there helping get access, just like we do the free eye exams when we go to the NOA conventions each year. We partner with people like VSP and do free eye exams, and we do dilations on patients in underserved communities, trying to catch things that wouldn't be caught because they don't have access to the care. So we go in and we do those free eye exams, and so thankful that so many doctors and technicians and students volunteer to help get this work done year in and year out. So at the clinics there, how does vision care at those clinics, when you say they have an impact on healthcare in the communities that they're in? Can you speak on that a little bit as we are getting near the end? Because I know I used to see free health clinics throughout the city of Philadelphia when I was in optometry school, living in Philly for 4 years. And people had access to the medical doctor, because I went inside one, and I saw a dentist there, and then they had pharmacy. Not sure on the other end, I think maybe they had a peds doctor or peds department there as well at some of those free health clinics there. I don't know if that's similar to what you're talking about with the federally qualified health centers.
Yeah, we do have peds, but right now nurse practitioners are sort of replacing peds and some of the medical doctors as well. We do have a pharmacy. We just opened one of the pharmacies in one of our sites, and we're getting ready to open it in another site. The clinic I worked at in Cleveland, they had a pharmacy. I don't know how, but they've been open probably 50, 60 years. Our clinic is probably maybe 25, close to 25 years old. But the community health centers are providing a service. As I said, they reduce the barrier to care. So once we get the patient in the offices, I'll see a patient who comes in because they're blurry vision. They've never had an eye exam, and they may not have had a physical. So they come in to see me, and I examine their eyes, and lo and behold, we find out that they're diabetic. So once we have them in the door, it's a lot easier to say, okay, I'm going to take you to the front desk. We want you to schedule to see our primary, get you established with a primary care provider. So we may be the first line of care. We are primary health. We may be the first line of care that a patient may see. So it's because they can't see. So it's something very tangible. If you're starting to lose your vision, you don't want to go blind, you're going to go. Okay. So once we get them in the door, we get them in so that they can see the dentist, see a primary care doctor. And from there on, we're doing prevention. So it's a win-win situation. And I just wish that more of the community health centers had vision care.
Well, that's good. And, I wonder, and Dr. Davis kind of hit it right on the nail there when she asked this question. Do you think there should be an emphasis on encouraging, supporting our new optometry graduates to consider working in community health centers? Is that something you would say?
I would say yes. Something else that we also need is we need to get reimbursement from the National Health Service Corps. So a lot of the other professions, if you work if you got a loan scholarship from National Health Service Corps, you go back and work in the community health center, and your loan is paid off. We were a part of that years ago. And we've been trying to get back into that. That would actually help the graduates want to come work in the community health centers. We had been trying to hire an optometrist for about the past 2 years. So we did hire one. He didn't stay long. So what we ended up having to do is outsource. So I think if we could get optometry back into the National Health Service course, part of that reimbursement, that would be an incentive to get more optometrists to want to come and work in these in the clinics. And I think part of the issue is we're in inner city, and new graduates want to go. We're in Lorraine. They want to go to Westlake. They want to go to North Olmsted. So they don't want to come work in inner city. And that's an issue. But if there's a big incentive where their loan would get repaid because they worked there for years, then that would solve the problem.
Right. That would be great. Say, hey, commit whatever, 5-10 years.
Correct.
We cover your loan, your service in the community. You're getting, this pay as well. That would be some motivation because you leave school now in debt a lot there. So that would help a lot of new grads see the light better as well there. And we appreciate, facilities like this and for you giving us insight, because you had the experience there. You've given us insight onto dry eye because of your experience with it and dealing with it day in and day out, helping a lot of people with dry eye. And it has been great information. I know our audience, they're just thrilled that we had you to close out 2024 in this special way and giving us all of this great information. And guys, just know if this was helpful for you, don't keep it. It's not a secret. Share the link to your friends and family. Text them the link so that they can listen to this webinar as well and receive some information. You can start conversations with your optometrist on your next visit as well if you've been experiencing some of the things that have been covered today as well. We always want you to feel comfortable having a one-on-one conversation with the person who's helping to take care of your vision as well there. Doctor, thank you so much for being our special guest with us. You guys give her some love down in the comment section in the chat there. Dr. Joyce Ramsue Thompson, we thank you so much. And as you close out, if you have any final words to say to our listening audience, I want to give you that opportunity. If you feel that someone may be trying to find you, want to see you or follow you on your social media pages or something, you can share that as well as you're closing us out tonight.
Okay, well, thank you for having me. Actually, I just want to go through that one question, that dry IQ. So the question was, and I was hoping to have some non-optometrists answer that question because I know the optometrists know the answer. It's not necessary to see your eye optometrist because your dry eye is not a serious condition. And all I want to say is that if you have dry eye and you need to get an appointment and have your eyes examined with your eye doctor, don't waste time because dry eye is a very serious condition. It can cause damage to the cornea. It can actually cause blindness. So please, thank you for being such a great audience.
Thank you again. We appreciate you so much. I applaud you for all of your years of service to people, to communities, to the young, to the old. Thank you so much. It takes special people to give the proper care to the people in the community and to do it with a smile. And you have a beautiful smile. I hope you and your family will have a happy holiday season. Merry Christmas to you all. And thank you for closing us out here in 2024.
Okay. Merry Christmas to everyone. Thank you for having me.
And there you go, folks. Another episode of Protecting the Vision as Dr. Joyce Ramsue Thompson has talked to us about dry eyes and given us insights into these federally qualified health centers. They're helping the community get access to care, breaking those barriers. They're stopping people from getting access to a physician. And thank you guys for tuning in to watch this last episode for the year of 2024 The previous episodes will be on our YouTube channel. If you want to go back and look at those, National Optometric Foundation, share it with a family member. You can go on our website, www.nationaloptometricfoundation.com, and we're on Facebook under the same name, National Optometric Foundation. And again, our Cash App is $Protecting the Vision. We are going to continue to do the great things that we do as the financial arm, supporting the National Optometric Association, supporting students in optometry school. We want to thank all of those who are a part of the NOA, the NOSA, and the NOF. Thank you so much for volunteering. Thank you for your time, your service to the communities. We wish you and your family a happy holiday season. Please be safe as you're traveling. Please continue to watch these great webinars and invite your family and friends as we continue to do this in 2025. We hope that you will continue to have a great evening. Once again, my name is Dr. Timothy Brown, board member for the National Optometric Foundation, and it has been my pleasure to have these webinars for you throughout the year, and looking forward to seeing you in 2025. Have a great day. Merry Christmas, everyone.